I'm Eric Street, a pediatrician here at the Children's Clinic of Tupelo. I grew up in Alcorn County in the Biggersville community and went to school there. Went on to Northeast Mississippi Community College, followed by Mississippi College, finishing up my degree there, and then went to medical school at University of Mississippi Medical Center in Jackson, where I stayed for my pediatric training as well. After completing that, I came here to Tupelo and have been here since 2009. Jaundice is a very common condition that most babies will have at least some degree of. It's caused by the baby's immature liver not being able to break down the byproducts of the red blood cells that are normally disposed of after babies are born. So because of that, you'll see a bit of a yellowish tinge to baby skin. Typically will start in the whites of the eyes and then move down from the face, chest, and abdomen, and sometimes on the arms and legs as well. In most cases, this is a mild and temporary condition that will pass on its own, but we have to monitor those levels because if they do get too high, they can cause problems, even to the degree of brain damage if the levels are too high for too long. The tricky thing about this is it's not only the level of the bilirubin, which is causing the jaundice, that is important, but also how old the baby is and hours of age relative to that level. And then also some babies have other risk factors such as prematurity or a family history, bleeding or bruising issues that can complicate this as well. So we have to monitor those things closely in all newborns, and at North Mississippi Medical Center, we're able to do that with a skin probe, which is nice because we don't have to stick the baby every time for a blood test, but that allows us to test every baby born in our hospital to follow those trends. Our nurses assess for jaundice regularly at their checks with baby as well, and the pediatrician, that's one of the things that we are looking at every day on our rounds also. So in treating jaundice, if it does become an issue, we have special lights that we can put baby on or under, which will help break down the jaundice in the skin to help it get out of the baby's body more quickly. So it is a very treatable condition when it does become an issue, but something that we have to monitor. The other thing to note about jaundice is the levels usually peak somewhere after 3 to 5 days of age. So most babies are going home before that time or right around in that range. So we typically will see babies back within a day or two after discharge in order to assess that jaundice and make sure that those peak levels have not moved too high too quickly. With the babies born at the Women's Hospital, we have a follow-up area set up where we have some excellent nurses who are able to see the baby back there at a designated newborn follow-up area in the Women's Hospital. They'll weigh your baby, they'll assess the baby, not only for jaundice, but also just looking them over head to toe. They want to hear about number of diapers and how feedings are going. And in addition to jaundice issues, our follow-up area allows for nursing babies, for breastfeeding moms and babies to be assessed, and then our lactation nurses are able to assist if there are issues or things that need troubleshooting in that area as well. And also would throw in here that our lactation nurses do an excellent job of trying to encourage breastfeeding for our babies and moms for as long as possible, and as long as the mom and baby desire for that to continue. So they also make themselves available for weeks and months past discharge if there are any issues or concerns that arise, they're available for a consultation even after the hospital period. Other skin kind of changes that can be seen very commonly, hands and feet can be blue, and sometimes even soon after delivery, that parents will note that even while in the hospital, and that may persist for weeks. And as long as it's only or mainly the hands and feet that are blue, that's considered normal, just a circulation pattern, especially if hands or feet become cool. That discoloration can be seen. Typically, the face and around the lips and mouth should not be blue unless very temporarily while baby's fussy or crying. But if the blueness around the face or lips persist, or especially if it's associated with breathing difficulty or feeding difficulty, then those can be signs of heart or lung issues that need to be evaluated very quickly. Yeah, so immediately after birth, babies have to transition from life in the womb to life out in our environment, breathing and those sorts of things. So their lungs initially are full of amniotic fluid. Those things have to transition, and because of that, the respiratory distress can be seen sometimes. Here initially with faster breathing or harder breathing. So that's something that's addressed right at the time of birth with suction, and occasionally if oxygen or things like that may be temporarily needed, but typically we expect those issues to resolve fairly quickly. Sometimes we do have to monitor your baby for even a few hours after birth if those transition times are a little slower to go through. So that is something that we continue to keep a watch on and treat as needed. Past that first initial few hours, once baby should be stable and with mom in the room on our mother-baby unit. If you do notice baby showing signs of difficulty breathing, such as ribs sucking in or breathing hard or fast, more than 60 times a minute, which is much faster than our typical adult respiratory rate. If you notice a grunting sound, especially when baby breathes out, flaring of their nose, nostrils, or again persistent blue kind of discoloration around the face and mouth, then those would be things to alert your caregiver for. Being born can be tough for babies as well as for moms. Very commonly we'll see bumps and bruises on babies, especially on the head as babies being born. Small scrapes, bruises, things like that can be normal, whether it's from forceps that were needed to assist with delivery or just bumps and bruises that occur naturally. Broken collarbones will occur sometimes in newborns as just a natural part of delivery, especially if baby is larger and the delivery is more difficult. This will heal on its own without much intervention. Typically we'll recommend keeping the arm still and motionless as much as possible. Baby won't require any kind of cast or orthopedic follow-up typically. And another thing to note along those lines is as the bone heals, you'll feel or see a little knot usually in the middle part of the collarbone as that bone is healing, and that's a good sign that new bone is forming around the fractured area, and that is something that we'll continue to follow with babies' checkups and should heal over just fine. The other birth injury that we would watch for is weakness in an arm, especially from nerves in the neck becoming stretched during the delivery process. Those typically will heal up within several weeks, but is again something that we we'll want to monitor. Sometimes your baby may need physical or occupational therapy to help with that healing process, but again, something that we'll continue to follow with our regular checkups. In general, I think everybody knows that babies cry, and sometimes it is difficult to figure out the reason for that crying, especially if your baby is fed, if they have a clean diaper. You can't discern any fever or other signs of illness or problems. It may just be that baby is fussy, so holding the baby, talking to him, or singing, swaddling, those things may help there initially, and as time goes on, you will typically get to where you can kind of figure out somewhat what a hunger cry is, or what other cries may actually indicate. If baby does cry unusually, loud shrieking cries if they're in pain, or a pattern that's different than normal, or if you ever have any concerns for something that may be out of the ordinary, feel free to give your pediatrician a call. So babies' abdominal muscles are not as strong, so typically after a meal their bellies will look more distended just naturally. So that is a normal thing, but you will sometimes see that baby has a bit of more of a distension down the middle, which typically is also a normal issue between the muscle layers of the abdomen there. Between feedings, though, when baby's quiet and at rest, typically the belly should be soft and not firm at all. If this distension is associated with vomiting or fussy pain type issues, then that would be something to check with your pediatrician about, especially if you have concerns for the baby's overall health, or something has changed with that. Constipation, or just slowing of the bowel movements, or even gas, are common issues that may cause that. But again, if any questions or concerns arise that seem out of the ordinary, feel free to give us a call. So in the first several days, your baby should have a wet diaper, pretty much one wet diaper for every day of age. So on day 1, we hope to see at least one wet diaper for baby. Day 2, at least 2 wet diapers, and so on. As far as poopy diapers, the first bowel movements are what we call meconium, which is a thick, tarry, dark kind of colored stool, which all babies have there initially, and after several bowel movements, they work that out of their system. We expect to see that first dirty diaper at least within the first 24 to 48 hours. And then as baby continues to eat, that stool transitions over to more of a normal baby stool consistency. That consistency should be soft, should never be hard or little balls, should not be bloody in any way. Stool consistency should be fairly constant. However, the nursing babies, or breastfed babies, may have more of a liquidy type stool than our formula-fed babies, which is also normal. Frequency may vary, especially after the transition period from meconium to normal stool, anywhere from once a day, or occasionally even every other day, all the way up to some babies still having a bowel movement almost every single time they eat. And as long as the stool is normal and baby's growing, and there's no other red flags, then that frequency can be normal anywhere within that range. So in general, a mild cough or sneeze, or even things like hiccups, are very normal and common for newborns to have, and a lot of those things may even be due to neurologic immaturity. If you do see coughing that's consistent during feeding times, that could be something that needs to be investigated. At first, baby may take a little bit of time to adjust to the speed of feeding, especially if breastfeeding and mom has a fast letdown. Then that's something that typically will sort itself out within a few days. But if baby consistently has coughing or gagging kind of problems with feeding with breast milk or with a bottle, then those could be signs of aspiration or milk going down into the lungs. So issues with the lungs or digestive tract would be things that we may need to investigate. And so especially at the very beginning, babies are very sleepy. They can sleep up to 18 hours a day, and that'd be normal. And I remember with our first baby, even though I'd learned these things in school and knew that 18 hours could be normal, actually seeing that day in, day out was just shocking of how little of the time she was actually awake. A newborn typically should not sleep more than 4 hours at a time without waking up to feed. So if your baby is asleep for that long, then we would recommend trying to wake baby up and feed. If your baby consistently does not want to wake up at that 4-hour mark, then that could be something to talk with your pediatrician about. With time, as baby gets older, we expect those stretches of sleep to get longer and hope those stretches of sleep will get longer. But here initially, in the first days and weeks, your baby typically does not have the reserves that they need to go that long without feedings. If feedings seem to be difficult for the baby, especially if baby has sweating with the feeds or seems to have breathing problems or is just always sleepy and hard to arouse, then that may be cause for concern and something worth contacting us for. Yeah, so in regards to safe sleep, you should hear from us through your stay at Women's Hospital about SIDS or sudden infant death syndrome. This is something that we don't fully understand still, but we do know several things that can be done to help decrease the chance and risk of this occurring. One big thing is for babies to sleep on their back always, and then also making sure baby is sleeping in their own bed, that they don't have loose blankets or anything in the bed that could get up around the face. If your baby does like to be kind of snugly swaddled, then that is definitely fine. And then also would make sure to avoid any kind of smoke exposure. With dressing your baby, typically your baby should be fine with no more than one layer additional to what you're comfortable with in that environment. So we don't want babies to get too warm either. So if your baby ever has a temperature of 100.4 or higher, then that would be a reason to get your baby in immediately, either to the clinic or to the emergency room if it's after hours. Babies, because they don't have a strongly developed immune system at this point, and because they've not received some routine vaccines to protect against other severe childhood illnesses, any kind of fever would be something that we would need to investigate for the baby for those reasons, and also the fact that it could worsen pretty quickly if there is an infection. So those things would need to be looked into. As far as measuring baby's temperature, we typically would recommend just a standard thermometer with temperature measurement under the arm or rectally. There are a lot of different types of thermometers available on the market. Ear thermometers are not recommended for babies, that they may not be as accurate. The standard type thermometers typically are best. If you have any concerns about any of these or other issues, please feel free to call your pediatrician to discuss those things. Currently, insurance companies are allowing us to do some phone visits or even video visits through an app on your smartphone or computer, which is a great way to connect with us, to ask some of these type questions if you have concerns. Especially if it is an issue that we can address without having to see the baby in person in the clinic. And also that allows you to avoid having to get out during times of coronavirus or other concerns, being out with a newborn. We as pediatricians chose to go into pediatrics because we want the best for children, so it's our privilege to partner with you in the care of your child.